Hi, my name is Elizabeth Yeu. I'm a cornea cataract and refractive surgeon at Virginia Eye Consultants. I am so fortunate to have with me the fantastic Dr. Vance Thompson with Vance Thompson Vision in Sioux Falls, South Dakota. I would like for him to also introduce himself. And we are here today to talk about how we are able to optimize our patients and help to meet expectations for our refractive cataract surgery patient outcomes.
Thank you, Liz. What a pleasure to do this with you. I practice ophthalmology in Sioux Falls, South Dakota, and am a big fan of osmolarity testing and dry eye testing, and have been really excited about this conversation.
Vance, you and I have I've been able to admire and work with you, and you've been such an incredible mentor over the years. I've learned a ton about you, as well as from you with regards to how to best manage our refractive surgery and our cataract surgery patients, because it really is a one-time surgical opportunity for us. But vision really is lifelong. It starts before us and after they leave our hands for us to give them those outcomes. And we have to meet their expectations, but we have to set their expectations to meet a certain 2020 outcomes. And that ocular surface is absolutely critical to hitting their refractive targets. So let's talk a little bit about that. And lab testing is critical in that process. Objectively, what do you do and how do you talk to your patients about that?
Well, Liz, I agree 100%. The tear film is so important, and I wish if there's anything I understood better at the beginning of my career is how powerful the air-tear interface is to image quality. We know the tear film has a huge therapeutic importance, over 1,600 proteins, antibiotic effects, carries oxygen, has the healing factors. Like I tell my patients, the cornea, the majority of it just doesn't have blood vessels, and the tears are the blood of the cornea. So, yes, a very strong therapeutic aspect to it, but the visual side of it, I also explain to my patients that are so focused on, for instance, the lens and, whether it's a wonderful implants or something for cataract surgery or in refractive surgery, I'll tell them the cornea has two times, more than two times the power of the lens. And the majority of that power happens right at the air tear interface. And so one of the most common reasons I see image quality reduced or frustrated patients is untreated dry eye. So I'm very aggressive with every single patient diagnostically and treatment wise with regards to the tear film.
Oh, that's such a great way to look at it. And truly, um, we have learned anecdotally and now supported by evidence through years and years of trying and realizing, wow, why are patients 2020 or not 2020 or some combination thereof and still unhappy is because there is this lid margin as well as ocular surface disease. And through all this diagnostic activity, objective evidence really is key to helping us diagnose them. As you and I have practices really set up where patients are coming to meet us for the first time for their refractive cataract surgery, we have to learn a lot about them as soon as possible to exactly understand where they're at in their level of this journey of their ocular surface. So, objectively, we need to kind of, from an algorithm standpoint, understand where they're coming from. Luckily, the ASCRS Cornea Clinical Committee came up with a specific preoperative cataract and refractive surgery algorithm that does help to define and help us and makes it as easy as possible. For myself, I find that two objective tests specific tear film osmolarity as well as meibography. Those are two essential tests for me to help me understand where they're at in years of doing different tests. To me, those are two key components to understand where they're at in their lid margin, as well as their tear film stability, and their ocular surface disease. How about you, Vance? What information do you look at and how does it help you?
Well, for anybody that hasn't read the ASCRS algorithm on, dry eye disease, please do it. If you really want to up your game and, bring some objectivity to your dry eye exams, not only is there a wonderful questionnaire, the Speed 2, that really kind of takes history to the next level, if you will. But also, just like you said, Liz, tear film osmolarity is right there before we even do an exam. I mean, it helps us to guide our next steps. And I'm with you. I really think, since we know that increased tear film osmolarity is really a concentrated tear film, I call it, and the majority of what osmolarity is testing is the sodium ion that really, when concentrated, causes that first step in the vicious cycle of dry eye ocular surface damage, and that is inflammation. And I, even when that patient, when I walk in the room or they walk in the room, I'm actually even looking at their tear prism from a distance. I'm looking, are they squinting? How comfortable do their eyes look? When you start thinking about this, there's some macro things you look at, and then I look at that tear film osmolarity, and it is my crossroads to what happens next. I am a big believer in meibography also, but that osmolarity, knowing about what is going to happen next in my exam, is something that's really important to me. And I know because there's been studies that have shown a concentrated tear film decreases the accuracy not only of your measurements, but also the healing. So if you want to reduce your enhancement rate and get better measurements, you're going to know that tear film, and you're going to know that those corneas heal more aggressively with a concentrated tear film. And I really want to normalize that osmolarity and understand it preoperatively, but even start the laser process when it's normalized. It's a wonderful indicator for tear film health.
That's right. And Chris Starr and Priya Gupta et al. Demonstrated that when you have that information over time of looking at the osmolarity levels and seeing hyperosmolarity versus difference in osmolarity versus normal osmolarity and compare it to my clinical examination, looking at my topography as well as my meibography, that really helps me to kind of put together an understanding of where they lie on the spectrum of their ocular surface health and how much I can trust what I'm seeing with their values and where they are if I need to treat them and if they really do qualify for certain lenses, or if I need to pre-treat them and acutely rehabilitate them before they're ready for refractive surgery. And this leads me to talk about, that's what really excites me about this next generation and really partnering with True Care Medical and their new Scout Pro device, which I'm not quite, we are so close to getting it at Virginia Eye Consultants, but I hear that Vance Thompson Vision, which no surprise, has several already. So tell me a little bit about how it has already increased efficiencies and processes for you, Vance, with the older version of tear osmolarity testing versus the Scout Pro.
Well, we've transitioned now from the TearLab device to the TrueCare Scout Pro device, and we have four of them, and it's even smaller. I mean, our staff just loves how it just, is very portable around the office. Still that very small sample size, which I think is super important in dry eye patients because they already have a reduced tear volume, and you don't want a test that's going to take a lot of time or bring discomfort or stimulate reflex tearing. So that small sample size and ease of use has been really good. And since, we have multiple providers, we need multiple devices because it's a part of every single exam in our office. We want to understand that, tear film so well, but the Scout Pro has fit seamlessly. I mean, it's like we've had it for a while. I mean, it just seems like we've had it forever. It fits so well.
And I understand that, whereas our device, which we love and it's an essential piece of our dry eye testing, is one box that's in a center part of each kind of silo, but it's in a center area that we have to wait at least over a minute to kind of wait in line, and the technicians are seeing what the results of the tests are. The Scout Pro device is portable, and it takes less than a minute, like 40 seconds, to get the actual numerical values read for both eyes. Isn't that correct?
Yes, that's exactly right. And I've also been amazed that how the patients are impressed that we actually even test with this technology because it looks high tech, it's very modern, and they really feel like it's the best eye exam they've ever had because this technology is almost futuristic, but it is so efficient in giving us that tear film osmolarity test.
That makes absolute sense. So ultimately, at the end of the day, why does osmolarity matter to you and to your clinical practice?
Well, Liz, I got to tell you, the further on I get in anterior segment surgery, and I like to talk about not just best corrected vision and uncorrected vision, but best corrected image quality, uncorrected image quality. I call it BCIQ and UCIQ, and really, after everything else, that tear film is such a powerful indicator of image quality. And I, not just check what their vision is with the Snellen chart and teach my team, but I want to know when they see that 2020 or 2015 line, what's the quality? Is there blink to blink variability? And when you start getting very sensitive about these things, since we know that implants don't vary with blinks, laser vision doesn't vary with blinks, it's that tear film. It's just so nice to have that objective test because so much of dry eye care is subjective. And so to complement it with a number that helps to guide me, that has brought a lot of reliability to me. And I'll even explain to patients your symptoms, I respect them if they're there. But if you are asymptomatic with your tear film, I have to tell you, so many people don't feel this problem with dry eyes and they have blur from it. Having this test is extremely powerful, not only for me to guide their therapy, but for my patient education about their tear film.
Excellent. Similarly, why does osmolarity matter to me and to my practice? I would say, having used tear osmolarity over the last 8 years, that journey has allowed me to have greater belief over time in credibility of how it has simplified dry eye disease and the value of diagnosis and what the tear film stability is actually doing at that point in time. So I can diagnose where they're at in combination with what is going on with their meibomian glands. I know how they're responding to treatment and what I need to do as next steps. So to recognize what I need to do to change things, or if we can kind of maintain. But in knowing the tear film osmolarity and use it as a reflection, and ask also with how the patient is doing, if there are, for example, patient complaints, then it also guides me to know there may be something else or a comorbid or a masquerader that is going on. If the tear film osmolarity is stable, for example, it may be conjunctival chalasis, or for example, Demodex blepharitis, and I'm not looking closely enough at a masquerader. So it really helps me simplify what else could be going on, because that osmolarity simplifies the track for me. So for me, it does help me to simplify the diagnosis of the tear film stability. And that's how it has really helped me with my dry eye disease diagnosis and management.
I find it interesting that you use the word simplify, Liz, because it wasn't that long ago that we knew tear film osmolarity was a powerful, important measure, but we didn't have the technology to do it. And Tier Lab brought that to us, and now TrueCara has made it even more portable and ease of use. But we used to even talk about this, Tier laboratory that was on a chip, just something that, was previously inaccessible to the average practicing ophthalmologist like myself. And to not only see now that Tier Lab on a chip, but to see the device get more and more portable, what it does for us has just been absolutely amazing in the management of our patients. And I literally do want to know what the tear film osmolarity is on every one of my patients.
Absolutely. So beautifully stated. Well, thank you, Vance, for taking time to spend with me as we discuss on how we take care of our patients in preparation for cataract and refractive surgery, and how objective testing, specifically tear film osmolarity through TrueCare Medical Scout Pro testing, has really helped elevate our game and simplify dry eye disease diagnosis and management.
Thank you, Liz.